A typical day in Libya, I have to say there really wasn't one. Working at the field hospital changed daily depending on how much fighting was going on in the area, how many civilians or fighters we were seeing. One day we could have less than 10 patients come in with just minor wounds or injuries, and then on our busiest day I think we saw about 130 patients, many of whom were really seriously ill with pretty severe trauma. So you had to be really prepared when you walked in every morning for a very slow day or the busiest day of your life. It was a small staff. We had about 2 or 3 expat emergency physicians and then a few Libyan local volunteer doctors, and then a small staff of nurses, mostly from Jordan actually, who worked at the field hospital. Perhaps the hardest part was being so far from home in an active war zone without the easy ability to communicate all the time. So internet was sometimes hard to get. There was no phone lines. We had to depend on satellite internet mostly for communication, which sometimes was slow or sometimes didn't work at all and was always very expensive. So communication was really difficult. I guess the biggest lesson that I learned was to kind of rely on my medical instincts, my clinical instincts, and to learn how to improvise. Everything was always changing, and sometimes we were seeing types of trauma that I had not seen a great deal of before, and especially dealing with limited resources, so working in a center without all of the backup care and the CT scans and everything that I was used to working with. So we had to learn how to improvise, how to use your physical exam to make diagnoses, use other modalities like ultrasound, for instance, which we had, and then also even for treating patients, how to use different tools that we had available to do the same job that we would do back home. Rhode Island Hospital is a level 1 trauma center, and it's definitely the busiest trauma center in New England. And so working at Rhode Island Hospital, I've definitely seen a lot of penetrating trauma and blunt trauma, and that's definitely helped prepare me in some ways for the types of injuries that I saw. I mean, in general, most of the injuries that I saw in Libya were ones that I had seen in Rhode Island previously, but just on a much greater scale. Yeah, certainly. I've volunteered with International Medical Corps in the past. I was with them in Haiti after the earthquake last year, and do plan on doing trips with them again in the future to other types of disaster or conflict situations.